So hello everyone, welcome to our today's session entitled Obesity, a Cosmetic Concern or a Complex Disease. With the collaboration of Baylor St Medical Center, we are honored today to have with us Dr. Mattar, visiting professor of surgery, Chief Division of Metabolic and Weight at Baylor College of Medicine, Houston. Dr. Mattar is a past president of the American Society of Metabolic and Bariatric Surgeons. Now he's member of Board of Directors and American Board of Obesity Medicine, member Executive Council at the American Society for Metabolic and Bariatric Surgeons. Welcome, Dr. Mattar. We are very pleased to discuss with you a very interesting subject today that not only affects people's physical health, also mental health. A lot of people consider obesity a cosmetic concern, but we know it's not the truth. We know that obesity is a medical problem and a complex disease. So my first question for you, doctor, is what can you tell us about obesity, and why do we consider it a serious illness?
First of all, thank you very much for having me and inviting me to your very exciting program. Obesity is indeed a disease, and it's not a disease by itself, but it's part of a syndrome of different diseases that together we call the metabolic syndrome. We feel that obesity is just part of this metabolic syndrome, which is really a dysfunction of our metabolism that starts to change the way we process energy, so that the body starts storing more energy, and at the same time, the chronic inflammation that happens as part of this metabolic syndrome then initiates disease processes that can be chronic, but also very dangerous to the health and well-being of patients, such as diabetes, hypertension, sleep apnea, high cholesterol, and all these disease processes. Mm-hmm. So obesity is indeed a problem of a much bigger picture.
Yeah, so we know that obesity is linked to many health problems, like you have said, the diabetes, high blood pressure, heart diseases, but what is the role of weight in our overall health? How is it linked?
Yes, so we're not exactly sure why it is that people gain weight as a result of the metabolic syndrome, but it is an important indicator. It's a symptom, just like patients who have the flu have a fever, just like patients who have heart disease have chest pain, patients who have the metabolic syndrome express overweight and obesity. So whenever we see people who are overweight, then we must study these patients and make sure that we discover, if any, other disease processes.
Mm-hmm. And doctor, what is the difference between overweight and being obese? When a person is considered obese?
It's a scale. So we have, it depends on how much extra weight the patient has or the person has. We use a formula called the body mass index, which is a combination of a patient's height and a patient's weight, because we can't go by weight alone. Some people are tall and thin who weigh the same as someone who's short and heavy. So we use the body mass index, and typically patients, and you can calculate this off the computer easily, just BMI calculator. And patients whose BMI is 25 are normal. Patients whose BMI is between 30 and 35 are overweight. Are obese, and then above 35 is severely obese.
Okay. So why does obesity happen? So do we know the causes of obesity? Do we know that, do we have an idea when a person can be obese or not? Is it genetic?
Unfortunately, we do not know. We know that there are many factors involved. There are many subtypes of obesity. There is obesity that's due to genetic factors. it just seems to run in the family. There are also environmental factors. There are some disease processes like thyroid disease or some drugs, medications that increase appetite. But there is not one single factor that we've discovered. I wish we had, because then we would have treated everybody easily with medication. But because there are so many factors involved, we think that there are many different subtypes, and we're still at an early stage of understanding what causes obesity. But we know for certain that it is not patient-driven. We know for certain that it's patients do not want to become obese. It's not a preference. It's a disease that's driving this behavior and forcing patients to go and search for more food or more calories.
And is it curable, this illness, is it curable? We know that we have the weight loss surgery option, but is it an option for everyone, or who can be a candidate for a weight loss surgery?
So what we can do is treat the underlying metabolic syndrome, that process that is making the patient gain weight. We can stop that through weight loss surgery. That's how it works. Cure it is scientifically speaking, curing something is more difficult because it can always come back. So what I'm trying to say is that patients, after losing weight, as we all have, everybody's tried to lose weight and dieted in the past, we find that the weight comes back. So this is why we can't say that we've cured the disease. Now, weight loss surgery turns out to be very effective and very safe, but it can only be really offered to patients who meet certain criteria. So back to the body mass index, or the BMI formula that we have, typically patients who reach a BMI of 40 tend to be candidates. Patients whose BMI is between 35 and 40 usually must have one or two of those diseases that I mentioned, such as diabetes, high blood pressure, sleep apnea. Also, of course, patients need to understand that the surgery is going to change their lifestyle, because it dramatically drops the appetite, the hunger. So they'll have to be very careful in learning how to eat in a new way, in a healthier way. And they have to be motivated, and they have to be willing to follow up, make sure that they stay, healthy, so they don't get any complications. So nobody really rushes into this operation. We like to prepare patients beforehand and educate them.
So when a patient comes to you and tell you, doctor, please, I need to lose weight, and for example, I had a BMI of 36 or 37. I'm not in the 40s yet, but so we know that some patients gain more weight just to reach the 40 BMI, just to be able to do the surgery. What do you tell these patients when they come?
Of course, I can't encourage them to gain more weight so that they qualify. That would be unethical. However, I know that for certain, these patients, if allowed the time, they will gain weight and become eligible in time. So I will have a frank discussion with them and tell them that even though all of your criteria are not there, I think surgery is correct for you, because if we don't do it this year, we're going to have to do it in 1 or 2 years later. And it's better to do it now when you're younger or when you have less risk of complications.
So doctor, can you tell us the main types of weight loss surgery? What do we have? What are the recent types of weight loss surgery? And what is the difference between them also?
Of course. So first of all, we do all our operations laparoscopically. And for those who are not familiar, this means that we do all our operations without big incision. We do it through small keyhole incisions and insert a camera inside. And then the main operations are two popular ones. One is the sleeve gastrectomy, and the other is the gastric bypass. The sleeve gastrectomy is the simpler operation, and it's focused only on the stomach. And in that operation, we just make the stomach narrower, smaller. And the way I explain to patients, our stomachs are about the size and shape of a football, and I make it into the size and shape of a banana. And the reason we do that is that we remove that part of the stomach that stretches, that allows people to eat a large meal. Also, we remove that part of the stomach that is the seat of a certain hormone that travels in the circulation and stimulates the appetite center to tell us that we're hungry. It's called ghrelin. So when we remove this, the patients, first of all, have a much reduced capacity for food, but they're also not hungry. Okay. So there's no appetite. They have to be reminded to eat. And this is how it's different than dieting, because patients lose weight with no stress. Okay. I forgot to mention, when you asked me about the causes of obesity, I think stress is a big, big factor. You know, people tend to eat more when they're under stress. The other operation, so that operation, the sleeve, takes about 45 minutes, maybe an hour to do. Mm-hmm. The gastric bypass is a little more complex. In the gastric bypass, we partition the stomach. We separate the stomach from its top end. And the top end we call a pouch, like a little bag. And it's about the size of a ping pong ball. Yeah. And then we bring up a loop of intestine and connect it to that pouch, so that now the food travels down the esophagus, fills the pouch, and then goes down the intestine where there's another connection with the rest of the intestine, where the food meets with the digestive juices and breaks down. Mm-hmm. So as you can imagine, this is a more complex operation. It takes, there are 2 surgical connections to do. It takes about 2.5, 3 hours. And in both cases, the patients stay in hospital for 1 or 2 nights. Okay. Most patients prefer the sleeve because it's simpler, it's less complex, and frankly, both operations give similar results. They're both as beneficial in weight loss and in resolution or improvement of the associated diseases.
So, is any patient cannot have a sleeve? So you go for the bypass or the other way?
There are some patients who, for example, have very bad acid reflux, mm-hmm. and we find that those patients do better with the gastric bypass, because the gastric bypass diverts all the acid away from the esophagus. Mm-hmm. But by and large, the majority of patients are good candidates for the sleeve.
For the sleeve. So, doctor, we heard about something called enterogastric balloon.
Yes.
So what is it? I think they are telling us it's less invasive than other surgeries. It's available for everyone. Is it true?
Yeah, well, it's true that it's an option for weight loss. It's a non-surgical option for weight loss, mm-hmm. meaning there's no surgery involved. This is a balloon that is placed endoscopically with the endoscope. Mostly under general anesthesia. It's done as an outpatient procedure, mm-hmm. and the balloon is placed and then inflated to become the size of a grapefruit in the stomach. Okay. So it occupies a lot of the stomach, and that way the patient feels full. There's some nausea involved. The thing about the balloon is that first of all, it is offered to patients whose BMI is between 30 and 40, uh-huh. and also, so it can't be offered to very large patients who are expecting to have dramatic weight loss. Mm-hmm. The other thing about the balloon is that it's a temporary option, meaning the patients have it placed and it stays in the stomach for 6 months. And then it's removed after 6 months. Okay. There are some balloons that are designed to stay for 1 year, but none of them are permanent solutions. Mm-hmm. The idea is that while the patient has the balloon, they start learning a new method of eating and drinking that then they will sustain for the rest of their lives. Okay. I am a proponent of the balloon in special circumstances. But I am not a proponent for its widespread use, because it doesn't seem to address the metabolic syndrome, the underlying metabolic problems that many patients have. And this is why we find that a lot of patients, after their balloon has been removed, they regain their weight again.
So do you mean that it's considered more cosmetic surgery than, or not?
You know, I don't want to get into that discussion about cosmesis versus medical necessity. But there's no doubt that there are some patients and indeed some physicians who offer it as a cosmetic procedure. I would not do that.
Yeah. So, doctor, what are the main complications that the patient can face during the surgery? And we're gonna also, he's gonna face after surgery. What are the main complications?
So, like any surgery, there's always the risk of bleeding or infection, some technical problem. That is very rare now because we've become very skilled at doing this operation. Mm-hmm. The main complication or the main challenge that patients have after the surgery is being well hydrated. There's a risk of dehydration because right now when we're thirsty, we just take a glass of water and drink it down, or a bottle of water and drink it down. After surgery, these patients cannot do that because their capacity is so small. So we train the patients even before surgery to get into the habit of drinking water all day long. Just sip, sip, sip through the day. Because we find that the most common reason for them coming back to hospital or having a problem is dehydration. And then they have to get intravenous fluids. Mm-hmm. The other complication that can happen is nutritional deficiencies in the long term. This is why all our patients have to take vitamins and mineral supplements for the rest of their lives. And some patients complain about that, but I tell them, take 2 vitamins a day is better than taking 20 pills for other diseases.
Of course.
Yeah.
So, and what are the lifestyle changes that are necessary after the weight loss? Because we know that many lifestyle changes should be followed by the.
We call it a package. I mean, the surgery itself is a small part of the process. Mm-hmm. And this is why in our team, we have dietitians, we have psychologists, we have exercise therapists. We all work together to deliver a complete package to the patient. The weight loss after surgery happens mostly automatically. Every patient is going to lose weight. The challenge, Myrna, is keeping the weight off.
Yeah.
And this is where the lifestyle changes come into play. So from the beginning, we educate the patients on importance of eating 3 main meals a day, on eating the right quality of food, especially protein, and reduce the amount of carbohydrates. We also train them to drink plenty because hydration adds energy. Importantly, also, we ask them to become more active. And I'm not saying exercise to become an Olympic athlete. I'm just saying exercise every day to move around, walk more, and strengthen your muscles, because it's important that patients lose the fat that's in their body and preserve as much muscle as possible. Mm-hmm. So these are the lifestyle changes that we ask patients to do.
So, and how long after surgery can a person go back to exercising? And for example, if he wants to go to the gym or...
Yeah, so patients are in hospital for 1 or 2 nights. Then we usually ask them to not go back to work for about maybe 2 weeks because they'll be a little tired. The pain, by the way, is not an important factor. After the 4th, 5th day, there is very little pain. As for exercising, we want the energy that I mentioned to come back, and it comes back in a very big way at about 4 to 6 weeks after surgery. The energy levels go through the roof, and the patients, in fact, become very restless. And this is when we tell them, now's the time to go to the gym, find a trainer, and start working out. And they will do it very gladly So 4 to 6 weeks.
And do some patients face malnutrition after the surgery also? They have
Certainly.
for example.
There's always the risk. Yes, there's always the risk of malnutrition if they don't follow the guidelines and the advice that we give them. That's why it's so important to educate the patient as to where and how to find appropriate food and also take their vitamins, because they are at a risk of having vitamin D deficiency or protein deficiency. If they don't have enough protein, they can't build enough muscle, and they get weaker. So iron, calcium, all these things, it's important that they take the vitamins, and then it's important that they have lab blood tests every 6 months or every year to make sure that they're taking enough.
And do you advise the patients to have a nutritionist all the time after the surgery? Is it?
And not necessarily all the time, but just have one available.
Mm-hmm.
Should they have any questions, or maybe see a nutritionist periodically every 6 months or so, once they're used to the new lifestyle.
And doctor, we see some patients gaining weight again.
Yes.
After,
Yes.
for example, like 1 year. We
Yes.
see them, for example, they lose like 25, 30, 35 kilos, and then they will regain all the kilos back. What is the reason behind this?
Yes, we find that about 15% of our patients regain some amount of weight. It's very rare for them to regain all the weight that they lost, but there is some percentage of weight that can come back. And we think this is because of the chronic nature of our disease. Mm-hmm. You know, in some patients, you do an operation and then the disease comes back and you have to do more treatments. Mm-hmm. So we think that the weight comes back because the disease is still, like I said, sometimes underneath, they're still working up. And what we do for these patients, of course, it's important. This is why follow-up is so important, because once we notice that not only the amount of weight, but the rate of weight regain, if it's fast, then it needs to be treated. And this is where they need to see a nutritionist, need to see a doctor, get back on track again. Or sometimes we may need to add one of the weight loss medications that we have, on top of the surgery to make sure that the weight doesn't come back.
And doctor, we see some patients after the surgery facing a mental breakdown because of the weight loss, the quick weight loss, I mean. So how do you deal with these patients? Because some patients, they will have like loose skin everywhere in their hands, in their belly. So it's cosmetically, it's not appropriate for them. So they see themselves worse than before, than when they had.
I congratulate you on how well informed you are about our patients. It sounds like you're very familiar. So you're absolutely right. This is why I mentioned that our multidisciplinary team includes a psychologist. As I mentioned earlier, stress is a very important factor in our lives. And in fact, also mental diseases or mental disorders can be very important in our patients. We find that almost 60% of our patients who come in have depression. Yeah. Now, we don't know if the depression caused the weight gain or was it the weight gain that caused the depression. Mm-hmm. We're still not sure, but the fact is that it is there. And of course, stress can be a problem before and after surgery, especially in patients who lose a lot of weight, their appearance changes. They start receiving a lot of compliments. They start receiving a lot of attention that they're not used to. So that itself can be stressful. Yeah. There can be some family dynamics or social dynamics at play that can add stress. And on the other hand, as they lose weight, they do have loose skin. They worry about that a lot. It might impact their appearance. It might impact hygiene. It might impact even relationships with their spouses or family members. So in those patients whose loose skin becomes a real problem, we refer them or we counsel them to seek a plastic surgeon. who can then remove this extra skin and improve on their problems.
Mhm. So, and this removing of the skin, I mean, after with the plastic surgeon, is it considered a medical issue or a cosmetic issue? This is the problem, because many insurance companies, they don't they consider it like a plastic surgery, so it's not covered, for example.
Yeah.
Insurance or
You know, I tried to make a case on how this extra skin can impact someone's mood, and can impact relationships, and can impact hygiene. So these are all medical issues. Also, you know, a lot of patients can get skin rashes between the skin folds and need medications. So that is a medical issue.
Mm-hmm.
Unfortunately, you're right. Insurance companies, they're in the business of trying to reduce cost at all. And so they will label everything as cosmetic. So it's incumbent on the plastic surgeon to try and make a case to the insurance companies that this is not just cosmesis, that there is a medical reason for doing this for patients.
Mm-hmm. So, doctor, what are the main benefits that you see after a weight loss surgery?
So, in addition to the dramatic weight loss that patients experience, we see a very rapid, almost instant improvement in their diabetes. Mm-hmm. I just saw a patient yesterday whose blood glucose was very high, and within 2 weeks, it's come back to normal again. Mm-hmm. So in terms of diabetes, high blood pressure, sleep apnea, all these diseases are corrected with weight loss. And in addition to that, the increased energy that patients experience is really very uplifting, and they feel that they are alive again. They feel that they can go out and do more. And there are also psychological aspects to this. The dimensions in psychology is tremendous. They feel they're more confident, more self-esteem, more outgoing. So they do better at interviews. They do better at work. And finally, they're happier. I see them. And my clinic is a happy clinic. Patients are either happy they're getting surgery or they're happy they've had surgery. So so there are many, many benefits to this. Plus, you know, when you're spending less money on all these diseases, there are cost savings too. So it's an investment to have the surgery, but it has a good return on investment.
So we know that obesity is for example, is a very during the COVID-19, obesity is a very high risk for COVID patients, I mean. Do you advise people during this pandemic to do a surgery, a weight loss surgery, or should they postpone it till the end of the pandemic? If we see an end, hopefully.
So what the pandemic has done, what COVID has done, is highlight one of the main problems of obesity. We found that the riskiest, the patients who had the highest risk of death, mortality from COVID were the elderly. And then the next ones were the obese. And it turns out that being obese affects your immune system. And patients with obesity have a decreased immune system. And so their ability to fight off this virus is diminished. And this is why they had worse cases of lung disease, and they ended up in intensive care in larger numbers. So it brought into high profile the need to reduce weight to improve your health. Now, your question about the timing of surgery, of course, I'd like to say the sooner the better. But of course, we have to wait until the pandemic subsides a little more, because you want to reserve as much as possible the medical resources for those patients who are most at need. But I think that as soon as the pandemic starts decreasing, then we should really double the effort to treat patients with obesity to prevent this in the future.
So, doctor, at the end, you encourage people, obese people, I mean, to go and do the weight loss surgery, and why?
So yes, the answer is yes, I encourage them, just like I would encourage a patient who has high blood pressure to take medicine,
Yeah.
or a patient who has diabetes to take medicine for diabetes. A lot of patients have a reservation about bariatric surgery because they think it might be dangerous.
Mm-hmm.
But the fact of the matter is that it's more dangerous to not have surgery. The fact that diabetes will continue to advance and have its own complications, or high blood pressure might result in heart attacks, or sleep apnea might result in other problems. All these diseases are more dangerous than weight loss surgery, which is now as safe as natural childbirth.
Mm-hmm. So
the risk of death from bariatric surgery
yeah.
is the same as the risk of death from natural childbirth.
Do you have a percentage, survival rate percentage for people who went through weight loss surgery in comparison with people who are still obese?
Yes. So there's a very well-known study from McGill University a few years ago now, where they compared these two. They compared two groups of obese patients. Mm-hmm. One who did not receive surgery, and another group matched them who did not receive surgery. And the ones that did not receive surgery had a 9-fold increase in early death compared to the ones who had surgery.
Wow. So it's enormous.
Yes.
Okay, Dr. Mattar, thank you very much for your time. It was a very interview, and hopefully we'll have another one soon in the future.
I look forward to it. Thank you. I've really enjoyed myself, and thank you for your very informed questions.
Yeah, thank you for your time.